Hey guys, Ross here for Fit for Life Physical Therapy. Today I wanted to go over a couple techniques that can help fix your wrist pain. And this is wrist pain that's specifically felt on the top portion of the wrist when it's in a loaded position. So I'll have patients that will come in or even members from the gym and they'll say, well, I can't do push-ups because it hurts the top of my wrist. Or they'll also notice if they're holding a kettlebell or a barbell, dumbbell in an extended position, they get that same pinch. So the first thing that I'll tell them to do is actually go the opposite direction into repeated flexion. So all that means is we're gonna let our wrist drop down and I'm gonna use my opposite hand to now start to press it into flexion. So this is very similar to MDT concepts, but we wanna push it to our end range. If we're looking at it from a mechanical standpoint, as we're in extension, the top layer of bone slides this way, and sometimes that can cause a problem. So all we're doing is just getting it gliding in the opposite direction. Also, it may just be a different position that your body's not used to, so it's providing a new stimulus. So, 10, 12 repetitions, it may not be comfortable in the beginning, but I would certainly recommend practicing it a couple times a day. Now, once we start to get into having less pain, we then want to load it. So that comes into actually pushing down like we're doing a push-up. Now, typically, if someone comes into the clinic, I'll do what's called a mobilization to kind of wiggle the bones back and forth, but you can do that on your own. So even just finding a table, countertop, whatever it may be, all I'm gonna do is I'm gonna take my hand and use the web space and just block the top of my hand, and I'm just gonna rock into the stretch. So what this does, glides the wrist bones back this way, gives them a little bit more room to breathe. Now, you can do this without using this other hand, and you can just shift in and out of the stretch if you want to. You can even flip your hand all the way around and lean backwards. So what I like about that is you start getting a nice stretch into your flexors as well. But this typically will resolve any of that pinching pain that you'll have with push-ups within a couple of weeks. Again, it's usually due to repetitive stress. So just loosening up the wrist joint a little bit and then loading it appropriately will typically help out with those symptoms. So give those a shot. If you have any questions, just let me know, and thanks for watching.